After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify the patient using 2 identifiers.
Mr. Williams, sorry to bother you. My name is Jennifer. I'm going to be your nurse today. Can you tell me your name, please?
Henry Williams.
And your birthday?
In January 1946.
All right, thank you.
Body temperature is one of the vital signs, an important indicator of physiological status and response to physical, environmental, and psychological stressors. Before you take a temperature, identify factors that may interfere with temperature measurement. Then help the patient into a comfortable position that allows easy access to the selected route. Apply gloves if indicated. For example, your patient might have respiratory secretions or drainage from a facial or mouth wound. To take an oral temperature, pick up the thermometer or remove it from the charging unit and verify that the oral probe with the blue tip is attached. Grasp the top of the probe, but be careful not to apply pressure to the ejection button. Then slide a disposable cover over the probe until the cover locks in place. Ask the patient to open his mouth. Gently place the probe under his tongue in the posterior sublingual pocket, slightly off-center relative to the lower jaw. Ask the patient to hold the probe in place with his lips closed. Keep the probe in place until you hear the audible signal and the temperature measurement appears on the digital display. Remove the probe, read the display, and tell the patient his temperature.
98.6 is your temperature.
Now push the ejection button on the probe to discard the cover in the trash. Return the thermometer probe to its storage unit. Remove your gloves if worn and perform hand hygiene. As part of your follow-up care, document the patient's current temperature as his baseline, or compare it with his baseline and with the acceptable range for his age. For a rectal temperature, ensure the patient's privacy.
Mrs. Thompson. Hi, I'm Jennifer. I'm going to be your nurse. Can I check your armband, please? Can you state your name?
Mary Thompson.
And your birthday, please.
January 1st, 1950.
Thank you.
And help her into a side-lying or Sims position with her upper leg flexed. Move the bed linen to expose the patient's anal area while keeping her upper body and legs covered. Ensure that the anal area is clean. Put on gloves. Pick up the thermometer or remove the thermometer from the charging unit and attach the rectal probe with the red tip. Then slide a disposable cover over the probe, being careful not to press the ejection button. Insert the covered probe into an individual water-soluble lubricant packet. Dip the end of the probe into the lubricant, covering 1 to 1.5 inches of it for an adult. If you don't have individual packets, squeeze some lubricant from the tube onto a tissue. With your non-dominant hand, separate the patient's buttocks to expose her anus. Ask her to relax and breathe slowly. With your dominant hand, gently insert the probe about 3.5 centimeters or 1.5 inches into her anus in the direction of the umbilicus. Do not force the probe. Hold the probe in place. When you hear the audible signal and the digital display shows the patient's temperature, remove the probe. Discard the probe cover and wipe the probe with an alcohol swab and return the probe to the storage unit. Tell the patient her temperature.
Your temperature was 98.6.
And wipe her anal area with tissue to remove excess lubricant. Discard the tissue and your gloves in an appropriate receptacle. Raise the side rail and perform hand hygiene. Clean the base with an alcohol wipe and return the thermometer unit to the charging unit. As part of your follow-up care, document the patient's current temperature as her baseline, or compare it with her baseline and with the acceptable range for her age. For an axillary temperature, ensure the patient's privacy and help him into a supine or sitting position.
Mr. Vandelay?
Yes.
Hi, I'm Jennifer. I'm going to be your nurse.
Hi.
Can I help you roll on your back so you can get more
Sure.
comfortable? Thank you. If I could check your armband, can you state your name?
Tim Vandelay,
Okay, and your birthday.
December 7th, 1947.
Okay, thank you. I'm going to take your temperature under your arm now.
Okay.
Move his gown away from his shoulder and arm.
I'm gonna raise up
Raise
this
the
gown
patient's
up to your
arm
shoulder.
away from his torso and inspect his
raise that right
axillary
arm. I'm just
area
gonna use
for
a dry
lesions
washcloth
or
to take
heavy
off any moisture.
perspiration. If needed, pat the area dry. Pick up the thermometer and verify that the oral probe with the blue tip is attached. Holding the top of the probe, slide a disposable cover over it, avoiding the ejection button. Then place the probe in the center of his axilla and have him lay his arm over the probe and across his chest. Now hold the probe in place. Listen for the audible signal and watch the digital display. Then remove the probe and tell the patient his temperature.
Your temperature's 94.3.
Right.
If you could raise that right arm for me, please, and you can rest that back down.
Okay.
Discard the probe cover in an appropriate receptacle. Return the thermometer probe to the storage unit.
Are you comfortable right now, sir? Okay. The call light is right here on the side rail, the red cross button. You press it if you need anything at all, okay?
Okay.
All right, thank you.
Thanks.
Perform hand hygiene. As part of your follow-up care, document the patient's current temperature as his baseline, or compare it with his baseline and with the acceptable range for his age. Before using a tympanic thermometer, assess for factors that can affect the patient's temperature, such as otitis media, impacted cerumen, inflammation, or recent ear surgery.
Hi, I'm Jennifer. I'm going to be your nurse.
Okay.
Can I see your armband, please? Your name?
Karen Jones.
Okay, and your birthday, please.
6/27/47.
Okay, thank you.
If the patient has a hearing aid, remove it. Assist the patient into a comfortable position with her head turned to the side. For a side-lying patient, take the temperature in the ear that's exposed. Pick up the handheld thermometer unit. Now slide a disposable speculum cover over the otoscope lens tip until the cover locks in place. Avoid touching the lens cover. If you're right-handed, hold the thermometer in your right hand and use the patient's right ear. If you're left-handed, hold it in your left hand and use her left ear. Pull the pinna back, up and out. Fit the speculum tip snugly in the ear canal and aim it toward the patient's nose. With the speculum in place, press the scan button. Depending on the manufacturer's instructions, either move the speculum in a figure-8 pattern or keep it still and snug in the ear canal. Hold it in place until you hear the audible signal and the patient's temperature appears on the digital display. Then remove the speculum and eject the cover. If the temperature is abnormal or you need to take a second reading, apply a fresh speculum cover and repeat the process in the opposite ear. Or wait 2 to 3 minutes and repeat the reading in the same ear. Or consider using an alternative route or device. Tell the patient her temperature. Eject the speculum cover into the trash can. Help the patient into a comfortable position. Perform hand hygiene and return the handheld unit to the thermometer base or charging unit. As part of your follow-up care, document the patient's current temperature as her baseline, or compare it with her baseline and with the acceptable range for her age.